And we welcome Lena Cordy-Bancroft to the stage.
Hello, everyone. Welcome. Thank you for joining us today at BSI Healthcare Week, the Circularity session. Circularity in healthcare is it's one of my passions, and I think a passion as well of our two speakers that we have today with us. I was recently as in yesterday, I was on an airplane and happened to watch two programs which were really relevant to today's session. One is called A Plastic Ocean, which documents the global effects of plastic pollution and highlights the workable solutions and innovative solutions that everyone from government to individuals and everyone as a whole can do to create a cleaner and greener ocean, specifically about the ocean. The other program was called 2040, and it's an imagining of a future of where climate change has been solved. So in 2040, what it would look like if we were able to do all these, kind of in a dream of what would a green world look like, and really looking at different solutions that are currently being looked at, and different technologies. But both of these, as I was watching them, I thought, wow, this is really relevant to our discussion today, on bringing circularity to healthcare in order to promote a greener environment and more sustainable practices. And it'll be interesting to see kind of what, in terms of healthcare and medical devices and MedTech, what we can do in order to push more of these topics and solutions. It'd be really cool, I think, if we had medical MedTech versions of both of these shows, if you get a chance to watch them, that focus specifically on what we're doing in MedTech. And so to that end, I'm pleased to introduce our speakers today. We have two speakers. The first is Senko Dimov from NHS. He leads on supply chain decarbonization for Greener NHS program, including the implementation of NHS Net Zero Supplier Roadmap and reducing the environmental impact and waste associated with the use of medical devices and equipment. Senko has a decade of experience in sustainability, including circular economy innovation, social value, and resilience in large-scale engineering projects globally. So it'll be really interesting to hear what he has to say on what the NHS is doing from a circularity perspective and the systems approach to healthcare. I've known Senko for many years, and I'm super excited to have him as one of our panelists on today's webinar. So Senko, I turn it over to you.
Thank you so much, Lena. And thank you so much for sharing those stories at the beginning. I think that really helps set the scene for what we're hoping to achieve in this space. And so Lena invited me to speak today about the approach that NHS England are taking to circularity in healthcare. And I want to share quickly today some of the points as to why NHS England are interested in doing that, and some of the key levers or sort of methods or things that approaches we're taking to enable that change systematically. But before I launch into that, I just want to introduce Greener NHS quickly. So Greener NHS are a program within NHS England which have been set up to help deliver to communicate and to deliver the NHS's net zero commitments along with the rest of NHS organisations. And I think many on the call will already be familiar with our net zero commitments, but we have two. So the first is for 2040, and that's for the emissions we control directly, so scopes 1 and 2. And for scope 3, we have net zero by 2045. And that's the target which is most relevant to the topic of conversation today, which is our supply chain and how we work with that to achieving a net zero future. So why is the NHS aiming for net zero? What are we hoping to achieve? Well, the evidence is very clear. The climate emergency is a health emergency, and the World Health Organization have described the climate crisis as the single biggest threat facing humanity. And if unaddressed, it will disrupt care, it will affect patients and the public at every stage of our lives. So with that said, I think that line from Lord Darzi in his recent report on the state of NHS in England makes it very clear. Given the global health imperatives, the NHS must stick to its net zero ambitions. And fortunately, a lot of the actions that we would take to achieve net zero are also actions which bring about benefits in public health and health equity. So on the slide there, I've included improved diets and active travel, but also interventions such as electrifying our fleet, which is, I believe, the second largest in the UK, can help reduce air pollution, which can help prevent up to 38,000 deaths per year. So just to round this slide off, the NHS's core purpose is to improve health and care now and for future generations. And the steps that we're talking about today are absolutely key in doing that. So I've positioned the net zero ambitions within the health agenda and the benefits that we can achieve there. But the net zero transition doesn't just support health, it also supports other national priorities for the current government. And so I've listed a few here: creating NHS savings, improving resilience by minimizing reliance on volatile sources of supply, and driving UK growth. And these are all things we can achieve through net zero interventions. So one example there, I've just got an image. In March, Great British Energy committed to £100 million in support to help set up solar panels and renewables and battery storage across the NHS estate. That's something which is going to cut energy bills, but it's also something which is going to deliver net zero savings. And the bottom quote here we have from Baroness Merron about the Design for Life programme, which I'll come to in a later slide, which is about delivering circularity in the MedTech sector, identifies that the benefits that we will achieve through doing that are just as much for the UK growth mission and making UK a life sciences superpower as they are for helping us achieve net zero. Sorry, the slides are a bit slow. There we go. So I've named some pretty ambitious targets there. We're going to save the planet. We're going to make everyone healthier. We're going to make the UK a life sciences superpower. We're going to have more resilient supply. How do we get from gowns or from surgical instruments or from cystoscopes to those really big national ambitions? And the answer to that is a systems approach. The NHS has something in the field of 80,000 suppliers and something like 600,000 different types of medical devices on its catalogues. And so for us to achieve those ambitions, we very much need to take a systems approach. And in the next slide, I want to speak to some of the key levers that we have to enabling that system level change. So I'll address each of these in the following slides, but the first one, and I think the most important, is creating a shared vision and collaboration with our stakeholders. So this is the point, this is the enabler or the lever that everything else hinges on. And unless we can create a shared vision, unless we can all collaborate towards achieving that, we aren't going to be able to achieve those big benefits that we're hoping to. The other levers which I'll speak to are data and transparency. So having the information we need to target our, or to break down our targets into achievable steps and know that we're making progress against them. Obviously, having the infrastructure in place to reuse and to recycle and all elements of the circular economy are absolutely key. And apart from perhaps robotics, our medical devices don't use themselves. We need clinicians and we need all sorts of professionals to provide that care using medical devices and equipment, and making sure that those devices and equipment are situated safely within pathways and that clinicians have the resources they need to reuse them safely is absolutely key. And the final one, and perhaps most relevant to listeners on the call today, is innovation. And innovation will be in terms of product design, but it's much broader than that. And yeah, I'll come to that later. So first of all, just really quickly on shared vision, I already shared the NHS's net zero ambitions, but we've also in 2021 published the Net Zero Supplier Roadmap, which creates a set of steps between now and 2030 that our suppliers can take to help them align with our net zero ambitions. Also, last year in October, the Department of Health published the Design for Life Roadmap. So this is the program that Baroness Merrin did the quote for that I shared in an earlier slide. And that commitment is that by 2045, the UK will have transitioned away from all avoidable single-use MedTech products. So I think between these two vision pieces sets a very clear direction that the NHS is hoping to move in, but it obviously can't do it alone. And the steps that we've provided through the supplier roadmap, and I'm sure oncoming information in terms of the Design for Life roadmap, will help our suppliers and all our stakeholders come on that journey with us. Data and transparency. So this graphic has been shared from a report from the Brighton Sussex Medical School and shows some examples of where commonly used medical devices or equipment offer a environmental benefit if we transition to reuse. So already that gives us some idea as to an opportunity for change, but it goes beyond that. We've got the life cycle breakdown here of where emissions are in manufacture or in the use phase or in the reuse and logistics. Each of these steps need innovation, need focus to help target how we can reduce the emissions associated with that portion. And getting more information like this helps the NHS know what to target and where to prioritize its changes. And in return, the NHS needs to be more transparent with the way that it uses medical devices and equipment within pathways to help suppliers know where they can innovate and where they can support us on that journey too. One example of work that we're doing with BSI actually is PAS 2090, and so that is developing a standard for life cycle assessment of medicines and pharmaceuticals. So that's another area where we're undertaking work to help develop a common language so that we can understand exactly where we need to target or focus our efforts. So an absolutely key enabler of the circular economy is having the infrastructure in place to reuse equipment. And here I've shown a couple of examples. So that can be centralized or that can be decentralized. In terms of central sterile services capacity, we're undertaking research to find out where that is across the country, what the opportunities for growth are and for improvement are. But centralized sterile services won't always be the answer. Sometimes we need decentralized solutions. And in instances like that, we're working with organizations such as Macwell Health, who are part of the NHS Innovation Accelerator, to investigate opportunities there. And the example that I've got there is a UV decontamination unit, but there's lots of different methods for decentralized disinfection. And developing both centralized and decentralized solutions will be key to this transition. But it's not just all about physical infrastructure. We also need to have data infrastructure, which enables us to know how many times things are being reused, both for safety, but also for measuring the benefits that we're getting. And an absolutely key one is logistics, and not just getting products into hospitals, but getting them out again, and making sure that the fleet that we have to do that is electric or as low carbon as possible. So as mentioned, getting our clinicians on board is absolutely imperative. And what we're aiming for and what the Holy Grail would be is making sure that low carbon healthcare is the easiest healthcare. It's the easiest thing for our clinicians to do. And to get to that, we're developing resources with Royal Colleges, or if it's bodies like GERFT, but we're also developing training schemes and supporting local initiatives for reducing use or for reuse. But this isn't all about thinking around how can we use the product differently or how can we reuse it. It's also thinking about the pathway as a whole. If we're able to reshape the pathway in a way that prevents a surgery from needing to happen at all, that's a big benefit for the patient, but then also in terms of emissions. And is there ways that technology or innovation can help us prevent sort of additional visits to hospital or help reshape our pathway in a way that's better for patients and better for emissions? And so I think that takes me to the final one of the levers which I wanted to talk about today, and which is around innovation. And so a lot of the time when we talk about innovation, we imagine product development or changes to product design, but it goes much beyond that. We can think about actually how's that product used within a service, or can the product be provided as a service? How does it sit within the pathway? And I think the biggest example, or the most significant change or paradigm shift that we can take is changing our business models, or the business models that the NHS supports. So by that, I mean, is there a way to decouple the care that we provide from the emissions that are emitted? And that could be through servitization, as mentioned, or other approaches. And in the last year, I think it might have even been this year, the NHR have provided £42 million in funding to answer questions or to support innovation, just as I've described. And so 2 of those that have been successful have been University of Exeter and Brighton and Sussex Medical School, both of which have got track record of supporting low carbon healthcare, and hopefully some of the learnings that will come out of that will help inform both us and our suppliers. And in terms of supporting suppliers directly, we do this through SBRI Healthcare, which I believe since 2021 has supported over 40 different winners, of which a few examples are illustrated there. So that's all from me today. I think just the final slide that I wanted to end on was to reiterate that collaboration message. There's no way we're going to achieve a circular economy. There's no way we're going to achieve all of those benefits that I mentioned earlier without every part of the NHS and its value chain coming together. And so, yeah, so I wanted to just end there and pass back to Lena and say thanks again for having me.
Excellent. Thank you very much, Senko. I know I have a couple questions for you to follow up on, so I'm looking forward to the panel discussions. And that's just a quick reminder as well to anybody on our webinar. If you have any questions, please submit them into the panel, and we can hopefully address those during the live Q&A session. Now I would like to introduce our second guest speaker, Jo Bell. She is the Business Development Manager of Healthcare at Albus. She joined the plastics industry in analytical and rheology. And don't ask me what rheology is, because I'm not a biologist or a chemist or a scientist, so she can maybe get into that. In 1997, and then transitioned in 2002 to technical engineering, really focusing on the polyolefins for healthcare applications. In 2018, she joined Albus, working with global team supporting healthcare worldwide. So this is, I think, a really interesting opportunity to show a very scientific aspect, materials and the chemistry aspect of it, and how it relates specifically to medical devices. So it's a really interesting opportunity here. And she's excited to contribute to healthcare innovation through the use of plastics, which is something we all face with our devices, and this challenge between going from single use to reusable, and when is it appropriate, and really driving that positive change in the industry. So with that, I welcome Jo to the virtual stage, and welcome. Thank you.
Hi, everybody. Thank you very much, Lena. I'm very pleased to be here. I'm very passionate about this topic, so hopefully I don't get too engrossed in cheering on everything. Sorry, my slides aren't moving. Could you move me to the next slide, please? Thank you. So I'm talking about plastics. Obviously, with Lena's introduction, then you see that's my background. So the importance with plastics in healthcare, I think, is without question. Moving from using glass and metals, the risk of cross-contamination, and using plastics has enabled us to have single-use devices, which does have a huge benefit, also weight reduction and processing reductions. What we need to consider is how that change over the last sort of 50, 60 years has moved us into the risk of causing more damage to the environment, whilst we've been looking at improving people's general health. Next slide, please. So just to put this into context, when we're talking about plastics, depending on where you are in the supply chain will depend on how we as plastic suppliers are influencing your scope 1, scope 2, scope 3. And I really advise people to bring their suppliers into conversations about design and about redesigning of devices, particularly when they're looking at the green aspects of that, the recyclability of that, and also the manufacturing influence of that, because we can support various stages of the supply chain. So whether it's the material itself and its green level, or whether it's how you process it as a converter making components for medical devices. So if you could take a material that is, melts at a lower temperature, something that's easier to sterilize by a certain method that you've identified as would improve your reuse energy, and then also whether it's recyclable or not. So obviously different materials have a different ease of recycling and what kind of recycling they can go into. So we can affect quite a few different things as a material supplier. Next slide. So we could look at banning plastics and replace them with other materials, and the issue with that is that the LCA data, global warming potential on plastics materials, is actually lower than most of the materials in most circumstances. So because of this, what we need to look at is how we are using our resources, so how we are using plastics, and use innovation and the circular economy, including even things like using, say, a slightly stiffer material so you can use less of it, so that we can improve on how we're using plastics rather than replacing them with something else. Next slide, please. So we have some examples here of what kind of figures we have with using plastics in the healthcare industry. So they estimate that the healthcare industry is generating about 16 million tons of waste a year. That's a significant amount per bed, per patient, per day. And then you have to consider on top of that, you also have MedTech that's being used outside of a hospital, outside of a healthcare setting. And who you talk to depends on what figures you get, but it's generally speaking, most are saying 20 to 36% are plastics, but in other documentation they'll say about 10% are plastics. But if we look at how we use those plastics, we can significantly reduce how much is actually going into incineration or how much is going into landfill. So there's an example here from Surgical Innovations where they've looked at, if you use for one specific operation that there's about 70,000 done every year, if you make part of the device reusable, then you would reduce plastic waste by 83%, equivalent to 3.6 million bottles. So that's a huge amount of plastic. Now the thing is, people can be trained on how to separate it, and in different countries they are. It's quite a challenge for hospitals to be able to do this. Obviously it's slightly different if you're in a different setting. There may be more ways of doing it, but we want our hospital staff to be working on patients, not segregating waste. So the legislation often says you have to incinerate it, and whilst there's some regulations that allow you to do other things if it's safe to do so, it's taking the risk of doing that is what puts people off. Next slide, please. So in the Netherlands, they did a study and they looked at everything that's used looking after an intensive care patient for one day, 17 kilos. So as you can see there, you've got various different articles, and some of those are quite easy to recycle and some of them aren't. So it's how much of that can we recover and how much really does have to go into waste streams. Next slide, please. So here's just to put it in context, that they estimate from the World Health Organization is that 85% of the waste is actually not hazardous. So how can we consider what we can do in our design and development to make it much easier to separate that 15% away from that 85%? whether that's done in the hospital environment, in our home environment, whether it's going to a specialist waste company, whatever that is, how can we recover that? And then we need to look at the design that we're doing in order to improve how we do that. But when it does go to waste, we could still use it for something else. So the majority, the biggest portion of plastic waste is polyolefins, PVC and polystyrene. And those plastics could be used for something else. So there's an example here in Denmark where they took 300 kilos of waste and made it into a children's play climbing frame, as you can see in the picture. So it's things like that we have to think about. Where does the waste go? Could we, rather than just incinerating it or putting it into landfill when it's got to its end of life, could we give it a second life, even if that second life is something as simple as a children's climbing frame? Next slide, please. So going to the design part, I think it's quite easy to think we're designing something, it's an easy thing to do. It's actually not. And when you talk about material selection, which is where we come into, there's quite a lot of people involved that all have their own processes that they need to follow, boxes they need to tick, and they all have a different hat on and are thinking from things from a different angle. So design engineers want things to work. So what is the functionality of what they're trying to achieve, and how are they going to make it? How are they going to join things together? How are they going to print on it or laser mark it, all this kind of thing? And they quite often opt for familiar materials and don't necessarily think about, well, actually I could do that with this, and that could either make it easier to use it for longer, or it could make it easier to recycle, or it could be easier to produce with less energy, and so on. Quality obviously want to have the supporting documentation so that they know that the supplier is reliable, gives them the certification that they need, talks to them when changes happen. Regulatory obviously want to know about things like PFAS, nitrous amines, BSE, TSE. The purchasing department have got to focus not just on cost. I think we tend to think purchasing are just looking at cost. That's not their only driver. They need to have a reliable material supplier that will give them the support they need, a robust supply chain and availability. And we saw during COVID how important that is when things couldn't get out of China or couldn't go into China. There were a lot of suppliers here in Europe dashing around trying to find somebody else that could provide just one component that was holding up their assembly because that one component was stuck in a ship somewhere else. So it's very important that your supply chain is covered, and purchasing tend to be the ones to do that. Production, so once the design engineers have made something and they've probably done it in a nice laboratory environment, which is where, when I said I worked in analytical and rheology, I was working in a lab environment. We have time, we have space, we're not in a rush. Production have targets to meet, they have orders to meet, they have targets that they have to reach. And this means that when they have a product that's transferred to them from engineering, it really does need to be able to process consistently. And if something goes wrong, they want the supplier to come in and help them. They don't want to have availability issues where they have to suddenly try and find an alternative and make it work in their process window. So it's important that production can reliably produce what they're producing. And quite often, these are CMOs, CDMOs who would maybe be producing something for a few days, few weeks, few months, and then switching to something else because they tend to have a clean room with the machines that have different molding tools, and they're making multiple components for multiple customers. So they have to be able to switch between two and then stick within their validated window. And now we have this new thing, sustainability. It's quite new for us to have somebody dedicated to sustainability who's throwing their requirements in, which is end of life. What are we going to do with it when we've finished? What is looking on the LCA data, global warming potential? What's the environmental impact of what we're trying to do here? And then they quite often would say, well, do we really need to make it in plastic? Could we make it in cardboard? Could we make it in glass? So they've now put in another angle in here. Have the next slide, please. So if you put this all together, what you end up with is quite a complex list of requirements from all the different departments, including what comes as a service and support, information sharing, what is really the functionality and technical requirements of the device or the component, and then also how the products themselves are controlled and regulated, what support is in there in terms of biocompatibility, for example. And because it's so complicated, it makes sense to talk to the suppliers so that you don't have a nasty shock at the end of the process that you've been developing for 2 years, only to find it's not a medical grade and it's been deleted or it's been changed since you started the process. So we always say talk to the suppliers, make sure not just your tool designer or your molder, but also your raw material supplier actually knows what the intention is, what it's for, to make sure it's the right material and the best material for the job, with all the requirements, not just what the technical person wants or what the regulatory person wants, and so on. Next slide, please. So just to put this into context of how many different materials there are, so this is just what Albus can supply, and we probably supply 95% of plastics materials. You have different types of materials which have different requirements. So you've got amorphous, thermoplastic and semi-crystalline, but you also have standard, engineering and high performance. So if you're looking at making something more reusable, you're going to push yourselves to the higher part of that table. If you're wanting a single-use disposable, you'd probably be sat more down the bottom. In addition to that, we've now got medical grade plastics, so the service and support level needed for the healthcare industry, and now the green materials. So this is where they are mechanically recycled, chemically recycled, or use a biocircular or biopolymer in the material itself. So it's quite a complex structure, and by talking to your supplier you can find out what's available now with meeting medical grade and sustainable, and what will be available shortly, because we know what the suppliers are working on in order to make their products green in the future. So again, I encourage talking to the supplier and looking at, if we switch from this material to this material, could we improve our green fingerprint? Next slide, please. So now if we look at the circular economy versus regularity, so we all want to reuse, reduce, recycle. We're all familiar with this. However, when you're in healthcare, there's also regulations to consider. So just to give you one brief example, if we look at Article 17 of the MDR, you are allowed to reprocess and reuse single devices. However, it's down to the local country to make, so the competent authority to make a decision on whether they will or will not allow that. So not all do. And that means what happens locally can have an influence on what happens with your devices. And the reality is very few device manufacturers are producing in one country for one country. They tend to be global manufacturers or certainly regional manufacturers. So what is going on in France will influence what's going on in the UK or in Poland, because somebody is making a device and then it's being distributed throughout the continent. So we have to consider how we can influence this from a regulatory point of view to push the competent authorities to understand what is and isn't safe for the patient. And for that, we need some kind of regulatory change that puts more pressure on those local authorities to move away from saying you can't do this and you can't do that, to say you can do this and you can do that, but this and this have to be put in place first, so they're confident that the patient's safety is not put at risk. Next slide, please. So what we have in healthcare is drop-in solutions, and we also suggest to do design for sustainability. So obviously we have regulations that are now pushing towards designing for sustainability, and here the healthcare industry and the polymer industry can work together to improve this. So what we have is drop-in solutions. Next slide, please. So what this is where the polymer industry has looked at replacing fossil-based feedstocks with renewable feedstocks and advanced recycling feedstocks. So this is where you take waste polymers and you put them back to being monomers so that you can make new polymer without the history of whatever's happened to that product affecting its performance. Biopolymers are where we have naturally occurring resources. So you can have things like sugarcane used in certain plastics materials. So people probably are familiar with or certainly older people like myself, things like cellulose. This is now what we call copolyesters. So it's developed. We still use these materials, but they started off already using resources that are renewable. But now we're actually designing our existing polymers that were fossil into being available using those kinds of resources. And in addition to that, we're looking at where can we get our oils from that's not fossil. And then we have this biocircular. So this means we're taking waste, cooking oils, things from the agricultural industry, from the wood industry, taking the oils out of those, and then we're making chemically identical biogas and bio-naphtha, so the raw materials that go into these massive big chemical plants that process this material and then give us our nice little monomers, which are then sold on to the next part of the supply chain, so that they can then make our polymers out of it. So these renewable feedstocks reduce our global warming emissions and improve our global warming potential. What we have to consider is when you're talking about advanced recycling, because of the processes that are involved, you don't tend to improve your CO2 emissions, so you're still quite high. However, you're getting rid of waste, using waste in a way that is good for the environment instead of putting it in landfill or burning it. Next slide, please. So what's possibly hard for people to understand is why do we say it's identical? Because we're taking something from a different resource. The reality is, if you look on the left hand side of the slide, we take the renewable feedstock and the fossil and we're putting it into a cracker. That then is passed on to the next company in the supply chain, which is a polymerization company, and then it goes through all the making it into your components and then a medical device. How this is done currently is by mass balance, because it's all mixed in at the steam cracker stage. The reason it has to be done mixed is because these huge plants cost billions to produce, to make, so nobody can afford to have one for fossil and one for renewable. You have to mix it, so everybody knows what they put in and what they take out, and at the end of the day everything has to calculate as the same amount. So nobody can say I've bought 50 tons, so I'm going to sell 100 tons. You can only sell your 50 tons. And this is done by an audited certified body, so things like ISCC Plus and Red Cert. And this means that the chemical is the same that goes into the polymerization process. So the chemicals that you are looking at as the manufacturing industry in healthcare, doing your extractable testing, doing leachable testing, it is the same material without a change of formulation. What the regulators have said in various webinars I've been in is that we regulate polymers, not monomers. So they see it as it is a change, but not a huge change. And I think that's what needs to be spread around so that people understand they have the option to use this alternative method and it's not seen as a complete revalidation. Next slide, please. So normally I have this on 4 separate slides, but with the timing I've just put it all together, and I'd encourage anybody to reach out to talk to us if you'd like these expanding on. So what we have in terms of sustainable materials is so mechanically recycling has been around for decades, particularly in the automotive industry. In the healthcare industry, this is not really something that we've embraced, and the reason is we need traceability. We now have a very, very small number of materials that can be used in some applications, so probably more in packaging of medical devices. There are some that have European pharmacopoeia, so could be used in some pharmaceutical packaging. But in medical devices, we don't have that traceability, so they're still really on the fringe of what we do, and they would probably be something that you could look at for a very small amount of your components, not even a whole device, a component of it. Chemical recycling is very different. So this is where I've said it doesn't reduce your CO2 emissions, but what it does is make use of the waste of plastic. So it can't be mechanically recycled. What can we do with it? We can put it into chemical recycling. So this is actually a process where they put it back to the monomers. There's various different processes for doing it. So you can do it by solutions, you could do it by pyrolysis, and depending on what method you're using will depend on how much emissions are coming from that. But that means you can then, instead of digging out new resources, you're using the resources we already have in our hot, sweaty hands. So that's a big benefit of the whole circular economy, because you're reducing waste that's going to landfill or incineration. What we tend to focus on currently is the bio-based material. So this is biocircular and renewable. So biocircular is where we're taking waste from another industry, we're bringing it into our industry and making it into the right oils. Renewable is where the monomers are grown and we're extracting the oils to make our products from those renewable resources. So those are the four differences, and I could probably talk for an hour on those. So next slide, please. So if we put all this together, what we really need to do is look at how can we improve our existing platforms by looking at things like drop-in solutions. So where we've moved to a bio-based or whether that's biocircular or biorenewable, and chemically recycled products. Working at the early stages of new products to carefully select your materials so that you are optimizing the global warming potential of what you're selecting, and also all the processes like I want to reuse it X number of times. If you've got something that's partially reusable, partially single use, or you want to move it to that, then looking at what materials make it easy to do that and designing it so that you can separate them easily without the patient fiddling around and disassembling things they shouldn't do themselves. And also looking at how you can move contaminated parts from recyclable parts. Even if they're both are single use, some bits need to be put into that it's contaminated, it's hazardous, but other parts don't. So even if you're keeping it single use, still think about how you can do that. And then obviously you have use less material. So you could maybe transfer to a different grade so that you can use less of it to do the same job. And then obviously if you've got an existing platform, we know it's complicated, we know you can't easily change things, but if you have a conversation and look at what maybe small changes you could make that could improve that without having to do a full revalidation, so how can we work with you to assist with that? Next slide, please. So we have a number of suppliers who offer medical grades and sustainable grades. So this is ones that do both. We have more that do either. So we encourage, have a conversation. These guys give a lot of information that they're happy to discuss what they're trying to do. So some of our suppliers that currently are healthcare are also now working on their sustainable solutions. So more of them will pop up on that slide in the future. So it's worth having a discussion, seeing what those guys are doing. And then that's me done. So next slide. Luke is me saying thank you. So thank you for all of you for joining or listening later if you're listening to this on demand. And thank you to Lena for inviting me to join.
Thank you, Joe. Very much appreciate it. Yeah, and with that, I'm going to bring Senko back up onto the camera, and we've got some questions to go over. But I think what's really interesting, from these two presentations, is this whole concept about a systems approach. A lot of time, the NHS is this. When Senko and I were talking, kind of figuring out how we wanted to talk about his aspect of the presentation, is that it's the NHS is this huge system, and so we need to look at it from a systems approach. Medical devices, MedTech, trying to fit into this healthcare system when they've just got they've got little bits going into this big system and trying to make it fit. And it's really important that we continue with that systems approach, which is very related to obviously quality management systems and the thinking that manufacturers have. So there's a lot of synergy there, and I think that will really help propel everybody forward. And I think there's a lot of talk about regulations and and what's required. But both of you had examples of, you're talking about regulation, but then also how the standards are coming in and helping support that. So I don't like the term co-regulation between standards and regulation, but what the point is getting at is that standards are there to help support that regulation and bring that science, and so we can become much more systematic in our ability to change and make progress towards circularity. So I think this was an excellent example. Thank you both for bringing and sharing your insights on that. We do have some questions, so I'm going to go ahead and start. Senko, there's one for you regarding the greener NHS agenda and funding opportunities that seem to focus on net zero decarbonization rather than circularity. Although I think I think it's just a change in emphasis, or a different emphasis or focus, but it'll be interesting to see how you answer this. What appetite will there be in the future NHS 10-year plan to really broaden the focus to circularity of MedTech through design?
Great. Yeah, thank you, Lena. And I think maybe just before I come to the second part of the question there on the 10-year plan, just to reemphasize something I said earlier in the slide, Greener NHS have been set up to deliver on the government's net zero commitment. And so the government's net zero commitment is around emissions. And so the central pillar of the work that we do is around decarbonisation. Hence, what you will have observed around funding opportunities and Greener NHS focus in general being on carbon emissions. The way we think about it is that often to achieve the broader environmental impacts that we would like to, environmental benefits that we would like to, or capture opportunities such as reducing waste through circularity, those are often coupled as co-benefits to the net zero agenda. And so, you might see a focus on net zero, but we're very much looking more broadly than that. And in terms of the 10-year plan, I wish I could answer that accurately and say exactly what's going to be in there. And unfortunately, I can't do that today. But what I can do is just share a general trajectory that I've seen over the last few years. And so when I first joined NHS England, the concept of circularity was less spoken about. There was less awareness of it, and the same for broader government. But in that time, we've seen the effects of the disruption to supply chains that Joe mentioned post-COVID. We've seen a lot of conflict geopolitically. We've seen a lot of changes in the way that the world does business, and that's really changed the attitude or the focus or the awareness on the volatility or the vulnerabilities that we have in our supply chain. And so the benefits that we can see from circularity have gotten greater, or the risks associated with not being circular have gotten greater. And so, as I mentioned, the Design for Life roadmap was published last year, and that's from the Department of Health, and that's shown a big commitment from government towards circularity. But beyond that, we've also seen a circular economy task force be set up through DEFRA, and they have a commitment to publish a circular economy strategy for England, which it will encompass plastics and many of the other materials which are used in medical devices and equipment. And so, while I can't say exactly what's in the 10-year plan, I think we're all seeing a trajectory towards greater circularity, or trying to reap the benefits that we can get from circularity.
Excellent, thank you. Joe, did you have any? That was really related to the NHS and the 10-year plan, but I think from your perspective, when we're looking at this move towards circularity and supporting the greener NHS, what methodologies are available to manufacturers then to help quantify and show that their materials or their products are circular, in order to provide that evidence to NHS?
Yeah, so it's so obviously the main thing to compare materials is life cycle analysis, and those are provided by manufacturers on the cradle to gate. There's platforms being developed that would make that more specific, because at the moment, if you're at home using your AI or to look things up, you will get an average of that particular material, and in the future you should be able to go into a platform and get the exact one for that material, because obviously if somebody's making, say, a polycarbonate, if it's made with renewable energy and they've reduced the amount of water that they're using, it's going to be a different value from somebody who hasn't done that. So it will in the future get much more grade specific, rather than now it's just materials. That's usually done with ISO 14040 or 14044. Then the next step really is looking at moving to these greener products, and that tends to use an audited system, ISAC plus Red Cert, for example, where you track the recyclable materials, recycled materials or the bio-based materials, so that you can then see how much you're using. And there is a push from our industry to have this mass balance included in the regulations, to say that we need to get plastics used again. And the way to do that, from looking at the material side, is by using this mass balance approach, which then allows people to have a certificate that says, this is what I bought, this is what I've sold. And then you can pass that along the supply chain, so that everybody can prove with an audited system that they actually have used a biocircular material or a bio-based material, even if that's only 50% or 70%. Because obviously, depending on the plastic, depends on whether everything is available that way. So those are the methodologies. Now, chemical recycling will be done the same way. Whilst we're still mixing, and obviously this is going to go on for decades longer, whilst we're mixing fossil and brand new virgin materials with circular materials, we are going to have to use this mass balance approach. And I think it's becoming more and more accepted as it becomes more and more understood, but it's getting that across to people how it works is the tricky part.
Excellent. You bring up the LCAs. Both of you have talked about the life cycle assessments, and the NHS supplier roadmap includes a requirement to provide these LCAs. Is there any update on how this is actually going to be implemented? Any guidance, what standards will be adopted beyond the PAS 2090? I know that this is probably my BSI colleagues on the call are probably very interested in this as well, to see kind of what we can do to further enhance our standards. But how do we move from saying, yep, this is what we need, to how do we do it, and let's make that progress and take the step off the cliff to get going.
Great. So yes, you're right. The roadmap is very clear that the future direction, the 2028 milestone, is around developing a greater understanding of the carbon footprint associated with the life cycle of our products. But exactly, as you've identified, exactly how that's going to be implemented, we're still developing and working closely with industry to get there. So hopefully soon, Lena, we'll have more opportunities to have conversations around exactly how that can be implemented. And we're aware of the challenges associated with life cycle assessment, particularly when you consider the 600,000 odd products the NHS buys. So what we're absolutely committed to is making sure that the information that we're asking for enables us to take the best actions that we can and provide the least burden to our suppliers. So I can reassure you that's the commitment, and hopefully soon we'll be able to share with you more information through engagement and collaboration.
Excellent, thank you. And I think one part of this conversation that is right now kind of the elephant in the room, right? I hate that. Well, yeah, I use cliches, I guess, a lot, but and we don't have them on the call to answer this, but the role that MHRA and the regulators play, and are we seeing more biocircular materials or bio-based materials, some of these alternative options being supported and accepted by regulators, be it MHRA in the UK or FDA or the European Commission, in order to help support some of these initiatives? Because I think that's one of the hurdles that I've heard from from manufacturers is that we make these changes, but will they be accepted by the regulators? Joe, do you have any insight on that?
Yeah, as I alluded to in my presentation, I've been on webinars where people from actual people working in that field, so the FDA and MHRA have said, we do support the use of these materials. They are a change. We need the information, but they support it. The issue that I see for our customers, and obviously our customers, is it will depend on the person that it's sat in front. So the 2 people or 3 people or 4 people I've heard saying it might not be the person who those technical files end up with. So I think it needs to go to where we have a standard that says, this is appropriate. This can be used in healthcare. They're still going through biocompatibility testing, the same as a fossil-based material. There's then issues where people say, well, it's been used in cooking oil, so has somebody cooked a sausage in there? Is it now got animal derived additives in it? Well, no, it hasn't. It's fossils come from dinosaurs. So you could have all these arguments. So I think we need standards to say that this is acceptable, because while I think individuals at those regulatory authorities will support this, I think there will also be individuals who don't. So it has to be standardized so that those regulatory bodies are saying, yes, you can. So that it doesn't matter which competent authority you're in front of, it doesn't matter which regulatory body is reviewing everything, they all say, yes, you can do that. We understand the process, we understand why it's being done that way, and we understand it's properly being tracked, and we understand it's safe, off you go. And I do think they're pushing that way. I do think they're feeling that that's the way it should go. So I don't feel that there's a real resistance from them to do that.
Right.
But I do think you need the backup of saying, this is written down. Yes, you can. And I think at the moment it's not written down.
I agree with you on that, and I really like that kind of an answer, because it shows that the regulators' willingness to make progress as well, but also, they are a bit, and for good reason, a bit risk averse, and they need to be a little bit more, all right, let's sit back and make sure that let's make a change when it's right, rather than just jumping to it. One final question for you, Senko, and I think, because we've got just about a minute left, but I guess, from your perspective, how engaged are you seeing the MedTech sector in supporting NHS and these sustainability projects? Are you getting a lot of engagement with manufacturers?
Yeah, absolutely. I think I feel very fortunate to have a lot of both global manufacturers of medical devices and smaller SMEs, or UK based, really passionate about supporting the NHS in this journey and identifying opportunities for innovation which help both the NHS to deliver care, to do it in a net zero way, and new innovative ways of doing business with the NHS. And I think that's the bit that's really exciting for me, is seeing passion from our clinicians and passion from our supply chain around persevering through some of the barriers that myself and Joe have spoken about today, and continuing through that effort despite regulatory or other challenges to help bring about the benefit we're hoping for. So yeah, some really great engagement, and one of the, if I can plug it at the last moment, but one of the avenues where we see that most is through the Evergreen Sustainable Supplier Assessment. And so any suppliers who haven't engaged with the NHS through that, it's a great avenue to communicate where you're engaging, what your commitments are for net zero, and the steps you're taking to achieve that.
Excellent. Thank you very much. I know we're at time, and so then there's a lot more questions, that I have as well. So I think what we can do is maybe do a follow up with some, and answer these questions, online or somewhere as well, because this is a really great discussion, and it's important for us to start making that movement forward. There's been years of talk, but let's start making progress. And how do we share that? And there is progress being made, and making sure that people are aware of what's going on. I appreciate both of you so much for joining me today. This was an excellent event. Just a reminder that there is one more day left to BSI Healthcare Week. Join us tomorrow for a session on in silico trials. looking at the AI innovation and its impact on healthcare. If you have any AI questions, join us tomorrow, and hopefully those will be answered. Otherwise, thank you all very much for attending. Thank you to Tsenko and Joe for your insights and contributions to today's webinar. And thank you all for joining us today and hopefully becoming more passionate and taking that passion to your organizations to become a much more sustainable and circular industry, MedTech industry. So thank you all very much. Have a good day.
Thank you.
Thank you.